Tell Steve's a good politician. You know, 20 minutes fire drill, just right back on it. So thank you. All right, so we're now going to move to our first panel, and I want to introduce Michael Myers, who you've heard mentioned. He's been our partner in this exercise for the last several months. Michael is the managing director at Rockefeller Foundation, and as any of you know who aspire to a title like managing director, it means you just have several different jobs. Michael has been leading a lot of work for the years on global health. Of late, he has also taken on the domestic policy agenda and is leading Rockefeller's exploration of what we like to think of as a kind of inclusive economy program. Prior to joining Rockefeller in 2010, Michael served in the U.S. Senate in a number of senior staff roles, most prominently with the late Senator Ted Kennedy. He was the chief counsel and the staff director to Mr. Kennedy. And as you might imagine from Senator Kennedy's priorities, Michael worked a great deal on healthcare issues, on education, economic, immigration, and just broad kind of economic inclusion. And so I think the work that you're doing now does seem to be bringing you somewhat full circle. And I would just also note that Michael started, I guess, kind of the first chapter of his career working on critical issues about refugee rights, and has worked at the United States High Commission for Refugees. So if you could bring just a little bit of your global and local skills to bear on this panel, it would be greatly appreciated. So if the panelists can also join us.
It's a pleasure to be here, and I just want to thank Jason Grumet and the whole Bipartisan Policy Center team, Sandy, Tim, and others who've been so instrumental in pulling this together. And Matt, where's Matt from the, Matt, your team too at the National Association of Counties has just been amazing in surfacing the innovations that we see in counties all across the country. So thank you for that. And I also want to thank someone who's not here, which is my colleague Allison Wise, who was the program officer from the Rockefeller Foundation, who really helped drive this process from our end, and to work with the Bipartisan Policy Center and with NACO. So I'm very proud of her. The catalog, or she calls it the Atlas, I think, is something that we're all very proud of. So thank you for all of that. Let me just say a couple of words about the Rockefeller Foundation, then I'm eager for us to get on with our panelists. When we were established by John D. Rockefeller, now 105 years ago, he gave us the mandate to improve the well-being of humanity. Now, what better mandate can you have than something like that? And one thing that we've learned over the years is that often tools are over here, problems are over there, but we don't always bring those tools together to solve those problems. So that's what we try to do. Often the pieces are already out there, but the innovation is bringing them together in new and different ways in order to solve problems. So in doing that, we focus on health. We focus on food, and particularly nutrition now as a major component of that work. We focus on electric power for parts of the world where that's absent, building up mini grids using private sector tools for that as well. And now increasingly, and this is going to be a big part of our work going forward, is U.S. jobs and opportunity here in the United States. So those are our four areas where we try to get the tools and the problems together to come up with real solutions. So that's why this catalog is so exciting, because we see that happening in many parts of the country. Jason graciously mentioned in his introduction the time that I spent on Capitol Hill in the Senate, where we would pass legislation or influence policy, and in almost every case, the idea was not invented in Washington. Rather, communities around the country were the ones that came up with these innovative solutions. So part of my job was just scouting those out, trying to find them, find the creative solutions to pressing national problems in ways that communities themselves had already arrived at. So that's part of what's so exciting about this catalog, is finding what communities, what counties, what other units are doing around the country, figuring out ways that they can be shared and spread, as Steve, you were saying about the community, the community colleges, the ability to spread that. So spread these, and then maybe there's a federal play or a state play that would help scale these kinds of innovations so that other communities are enjoying the success that the few innovative communities are having. So that's what we're about today, is to learn a bit more about the way in which some of these ideas have come together, the way leaders within particular communities have formulated the approaches where they're seeing some success in moving the dial on opportunity for Americans across the country. And so I'm proud that we'll hear from them today. So let me start with Steve Rogers. And what we'll do today is they'll each make some opening statements that describe some innovations going on in their communities. And we'll have a little conversation about that up here, and then hope to leave some time toward the end for a couple of questions from you, the audience, to our panelists. So we'll start with Steve Rogers. And Steve is a sergeant.
Correct.
In the Lucas County Sheriff's Office, that's in the Toledo, Ohio area. And Steve has really come up through the ranks in the department, starting out as a 911 operator and dispatcher, then being out into the field, and more recently taking on responsibility for dealing with the opioid epidemic. So I won't prejudge, steal your thunder about what you're doing there, but tell us about the work that you're doing, why you're doing it, and some of the success and challenges that you're seeing as you move forward.
Absolutely. Thank you very much for the introduction. I'd like to start off by saying, on behalf of Sheriff John Tharp and the Lucas County Sheriff's Office,
So someone can hear.
Oh.
That'll help someone hear.
Sure. On behalf of Sheriff John Tharp and the Lucas County Sheriff's Office, we'd like to thank the Bipartisan Policy Center for the invitation and all the wonderful people who made this event happen. I'd like to start off also by sharing some statistics regarding Lucas County and the Toledo, Ohio area, where I was born and raised. In 2017, Lucas County reported 2,084 overdoses through its 911 system, which averages out to be 174 overdoses a month. As of May 31st of this year, Lucas County has reported 804 overdoses, which is an average of 161 overdoses per month. This does not include private transports to the hospital. The opiate epidemic is obviously a serious issue across the country. It's hitting Lucas County extremely hard. So how do we attempt to reduce the number of overdoses in Toledo, Ohio, Lucas County? Do we continue to incarcerate where it's been proven to be ineffective and also costly to the taxpayer, or do we try something new? The Drug Abuse Response Team, better known as DART, was implemented in July 2014 by Sheriff John Tharp. The mission of the Drug Abuse Response Team is to stop the profound number of deaths of loved ones caused by opiate overdoses while helping victims to overcome their addictions, and to also educate and support family and friends of these victims. Sheriff Tharp observed firsthand the number of individuals being housed in Lucas County Corrections Center dealing with an opiate-related addiction. These individuals would be booked into our jail, released, return to the same lifestyle, and eventually they'd end right back up into our jail. That's when Sheriff Tharp decided that it was time to try a new approach to engage the opiate crisis. The Drug Abuse Response Team is a county-wide unit. It's comprised of 13 full-time officers from the Lucas County Sheriff's Office, Lucas County Children's Services, Toledo Police Department, Mercy Health Department, Police, and we have several part-time officers from numerous agencies across Lucas County as well to form and complete the DART unit. We also have 2 officers, which are also counselors, that are assigned to our unit that are strictly responsible for educating the community on opiates and addiction. They encounter our high schools, the Toledo Public School System, the Boys and Girls Clubs of America, Children's Services. They are out there trying to educate, and DART or DARE stops in 5th grade. So now that we're able to form a relationship with the Toledo Public Schools, we're hoping to reduce the addiction stats in Lucas County by education as well as treatment. The goal of the DART unit is to link individuals to treatment and to assist with recovery housing needs. Once an overdose is reported through our 911 system, a DART officer is dispatched to a local hospital where they will engage this individual and offer treatment resources, whether it be detox or recovery housing needs. If the individual accepts our offer for assistance, then our DART officer will transport that individual once they're released and cleared medically at the hospital to a local treatment provider where they will help them with the paperwork, whatever they need done to enter their facility for detox. If they decline our acceptance for treatment help, the individual will be followed up within usually 48 to 72 hours after the initial engagement to try and once again to encourage them to allow us to assist them on their recovery journey. Since its inception, the DART unit has engaged 2,938 clients, with 457 of those individuals currently being active clients in our DART system. In 2017, the unit reported a 78% success rate with linking individuals to treatment. As of 2018, we currently have an 83% success rate with our linking individuals to treatment. That is currently what Lucas County is trying to engage and how we're trying to combat the opiate crisis in our county.
Great, thank you very much. We'll have some time to do some follow-up on that as well. This is really a remarkable story, so congratulations on that. Our next panelist is Lori Stegman, who's a commissioner in Multnomah County, and that's the Portland, Oregon area. And Lori's got a really remarkable background as a businesswoman, and I really respect, Lori, that you established your business in the same low-income neighborhood where you grew up. And so I commend you for that. And then her list of volunteer and other things that she's done within the community is quite extensive. I won't go into all of that, but now is a member of the county commission. So you've been doing some work lately at using data in order to think about place.
Yes.
Could you tell us about that?
Yes, absolutely. Well, thank you so much. Should we borrow this? I know that we have some. There we go. Thank you. So I want to talk about what's called a marginalization index today. And I can't see the slides, but is there a picture of Multnomah Falls there? That's my district. I live in one of the most beautiful scenic areas in Oregon. So I wanted to tell you a little bit about my district. There are 4 districts in Multnomah County, each representing about 200,000 people. And my district consists of the east side of the county that includes a little bit of Portland and 4 smaller suburbs, as well as the unincorporated areas. So I am proud, like I said, that I have the most gorgeous district. So my title to my program is Using Spatial Data for Base Place Planning. And for those of you who may not be familiar with the term spatial data, it's any data that can be mapped, and it's used to describe those things relating to areas. So in Multnomah County, it's really a tale of 2 cities. There should be a per capita bar chart up there, I hope. On the west side, you have the more affluent community. And on the east side, you have one of the poorest, which is why I introduced the East County Prosperity Initiative. In fact, if you were to divide Multnomah County in half along our 82nd Avenue and form 2 states, West Multnomah County and East Multnomah County, our per capita income would make West Multnomah County the 2nd wealthiest state in the country, and East Multnomah County would be the 2nd poorest. The disparity is masked because all too often our data are gathered and analyzed at a county level. So the increased property in West Multnomah County is nullifying the needs in East Multnomah County, and state funding formulas don't differentiate between the geographics. Therefore, unfortunately, East County is missing out on the funding that we so desperately need. We are working with a national consulting company, or a regional one, state and local elected officials, as well as community partners, to convene a dialogue about the intersections of housing, transportation, and economic development in East County. So this was a successful budget amendment that I introduced in fiscal year 2019 to support the strategic work that was necessary for the planning needed to get ahead of the impending growth coming our way. The good news is that we have a considerable amount of shovel-ready industrial lands. We have an Amazon, so for all of you that are fighting over Amazon, we have a distribution center in our district. And we also have a FedEx facility, as well as last month we just landed a company called Element 6, which is a division of De Beers Diamonds that will manufacture synthetic diamonds, just to name a few. So the challenge is that there are still deep inequities in our county, and the best way to address these is through data-informed policy making. This prosperity initiative will support our local jurisdictions, and we can use the marginalization index to make sure we're being thoughtful about service delivery and integration of our regional planning efforts. So it's based on a GIS platform, which stands for Geographic Information Systems, that utilizes data sets. Or in other words, it's a collection of related information that is composed of separate elements, but that can be manipulated as a unit by a computer. So think of individual keynotes on a piano that produce a certain sound, but when composed and arranged in a particular manner, can create a masterpiece. For our purposes, this masterpiece provides a snapshot of the issues facing our communities. And more specifically, it helps us drill down and assign local data to geographic levels like East County. Often using census data and other national data sets, GIS can only go as small as the geographic level at which the data are collected. Often that's city boundaries, zip codes, or even county boundaries, which makes it harder to make data-informed decisions for smaller areas like neighborhoods and areas around specific schools. In my district, we have 2 cities with a single zip code, which makes it challenging to disaggregate the data. But the data used in our marginalization index are available at a census tract level, which means that they're small enough to inform local policy decisions. The data we use are a collection of national census data like the ACS, American Community Survey, and locally produced data from our departments and local partners. The ability to analyze data spatially informs planning, enhances grant writing, and helps develop new locations for services. So why is this needed? I don't have to tell any of you how slow the wheels of government can be and how reactionary we are, while at the same time our communities are experiencing rapid change. We see issues of gentrification and displacement of our most vulnerable communities, and we need tools to act more quickly. Data are often outdated or anecdotal. Using data and reports with graphs and charts that are gathered in silos makes it difficult to draw multi-sector conclusions. We often begin from scratch by inventorying or scanning the current state of a particular issue. In a real-time GIS tool like this, it allows us to bring relevant data into conversations where they can inform decisions. Sometimes that's data that wouldn't otherwise be considered. For example, when looking at service expansion for transit, we might consider using data as data or population concentration, but it's also helpful to know where the multifamily housing is or where the school catchment boundaries are, so that stops can be added in locations that best serve those residents. Going a step further, imagine your local health department sharing WIC service data and the transit authority placing a stop near the most frequently used clinics to serve a more transit-dependent population. Regional issues like transportation, housing, and public safety spans jurisdictions. My county has 6 cities, 7 school districts, and various local and state service delivery areas. But to our community members, their problems are things they want and need a solution to. They don't care if that means crossing jurisdictional boundaries. GIS tools allow us to have a regional perspective on issues that may move over time, may disproportionately impact a certain part of the county, or could highlight a trend that traditional reports haven't picked up yet. So we often hear that a child's zip code dictates their future. In my district, the neighborhood that I grew up in is recognized as the most unhealthy zip code in all of Oregon. But just last week, we celebrated a launch of a veggie prescription service in that zip code to bring fresh vegetables to community residents through a community-supported agriculture program. This incredible work done by our health department is place-based and data-informed. It's a product of real-time data from our communities built on their input and opinions about what types of programs meet their needs. I believe that this is a best practice, and I'm so proud to lend my political voice to support it.
Great. Wonderful. Thank you so much for that, and I can't wait to get back to ask you a couple of questions, Lori, after we hear from Linda. Linda Smith is Director of Early Childhood Initiatives here at the Bipartisan Policy Center, and Linda is stepping in, if I may say, stepping in for Commissioner Merceria Ludgood from Mobile County, Alabama, who had a family emergency. So we wouldn't dare try to replicate what the commissioner was going to say. So Linda is picking a county that's on the other side of the country from Alabama to talk about a children's program that's in Maricopa County. So Linda, if you would tell us about it.
Yes, and I'll try to be brief on this because I see that we're running out of time, but I did want to bring into the conversation how we are taking some work that was done in a county and taking it first to a statewide level and on to the federal level to look at, I think, one of the most pressing issues that we have in this country right now, which is what are we going to do about child care and early education. As Jason was giving the numbers about how many of our young families are one paycheck away from disaster, much of that is in part caused by child care, lack of child care, or cost of child care. Those things all come together and create real hardships for our families. So with all of that said, we started working, this was before I was here, with Maricopa County in the greater Phoenix area to look at child care and what was going on with early care and education in the greater Phoenix area, hoping to understand what was going on with what we call child care deserts. And some of you have seen that work published around. So what we're trying to do here now at the Bipartisan Policy Center is take that from a county level and use what we're learning from, as people have alluded to, the best solutions coming from a county. How do we then take that and apply it to a state and or federal level? So what we're looking for in this project is where do we have child care? Where are the gaps in care, and what are we going to do about that? And how much is it going to cost us to fix what I think many of us who've worked in this for some time think is a broken system, if you want to call it a system at all. So what we're looking at now, and I'm going to quickly go through a few slides that are screenshots of the work done first in Maricopa County that looked at need versus supply, and then how we're taking that to the federal or to the state level, and now moving on to do some more states to see how hard it's going to be to take data and figure out what the need is on a 50-state comparison level so that we can influence both funding and policy here in Washington, D.C. as well as around states. So what I'm going to do, I think if I can, wrong way. So I'm going to quickly go through this. These are some of the things that were just spoken about in terms of the mapping. I'm going to move ahead here, and if I can see this, of how we've used this in the Phoenix area. So here is a look at the gaps for care. And if you look at this, you can see that a lot of the child care that is missing actually is in and around the suburbs and the outer parts of the Phoenix area. And so what we've been trying to think through now is what are the plans to fix this now that we know where these are. And these come into play, and I should say they intersect with a lot of the things that you were talking about, Lori, in terms of economic development strategies, transportation strategies, and how are we designing our communities and addressing this need that parents have for childcare where there is none. So I think we're trying to take a look at that and see. Now this looks at where we have capacity versus no capacity. So if you have more children than you have capacity or none at all. And I think those are two different things that we need to start considering. One of those where you have capacity in early childhood, we're starting to look at is what is it going to cost to get it up to a level of quality and reliability for parents that they can use it and have some comfort in that. And then the second is closing the gap where there is none at all. So in this one, I think shows you, I'm having a hard time seeing my own slides here. But, these are some other things that we just looked at. So this is the number of children. Now what I'm going to do next is, I'm going the wrong way again. Sorry, folks. What I want to do then is show you what we're doing statewide in Arizona now. We took the formula that we're using in the Phoenix area, which I will go back and say quickly that was developed when work was done at the Department of Defense on how they figured out their need for childcare. We took that formula that was used by the military years ago and are applying it to the population data now statewide in Arizona and, as I said, on into 2 more states. So what it amounts to is it looks at the number of parents, the number of single parents, the number, assuming all single parents need childcare, dual working families, parents who, and then mothers in the employment that are employed working full-time versus part-time. And you apply that to population data and it will show you where you have a need for childcare based on the demographic information of the family. So the next thing that we're looking at, and I'm going to try and see if I can find from my own, I want to skip forward to quickly to the. There's a whole bunch of ways that you can show the data, and these are just some of the ways that we're trying to look at that now in the Arizona area. But if you then move to where we have capacity, is where it starts to get interesting versus where we have a need for that. And I'm going to show you on the next slide the need, which is, I think I'm on the right one. Yep, I am. So if you look at the number there that's on that chart, the calculated gap between what we have and what we need is 54,000 spaces in the state of Arizona, which is significant. And how are we going to begin to plan for that becomes the question that we need to be addressing with this work. So let me see if I've got the right. The next thing that we did, and we did this, this was just recently done, was take a look at this by congressional district. Because what we wanted to see for people who are interested in this, and primarily congressmen, to take a look at their districts and see what they can do. Now, a lot of this data, these are screenshots of things, but I will tell you that most of this is interactive. And so a member of Congress here in Washington, a governor, a county representative, will, as we get through this project, ultimately be able to go in and manipulate their own data, looking at all of the data in here. So by age of child, by poverty level, by ethnicity, by a whole number of factors, that will be able to look at the data and figure out where they need to focus their efforts. One of the things that we're following on with this work is to try and figure out then the next step is what is it going to cost us to do it. But before we can actually go anywhere, whether it's to a Congress, to a state house, or to a county board of supervisors and ask for and think we are going to get funding for this, we need to be able to define this need versus the current capacity and give some real hard numbers to this. So some of you have probably seen this work. In many cases, there's mapping activities going on all across this country, but none that we think will give us a 50-state comparison of data and data that we then can translate into a policy agenda both here in Washington and at the local level. So that's the gist of what we're doing. We just started the work in 2 more states to see how hard this is going to be. The easy part is obviously the data coming out of ACS and the other census data that's out there. The hard part is finding the capacity data based on state licensing criteria and what's available. We just took a look at the Arizona data, and we all know in this country, if you're familiar with child care at all, that we have a crisis in infant toddler care in this country. And so what we've taken a look at, the gap versus the need in infant toddler care in Arizona, and it is staggering how much is not there. So at least it gives us a place now to start the work in terms of building the capacity and building the quality of this program as we move forward. So we're kind of excited, and thank you for the opportunity to give the pitch.
Great, great. Thank you so much, Linda. So let me throw out a question to all of you, and let's consider this a jump ball. Whoever grabs the question first is free to give the first answer. But I'm struck, all of you talked about numbers, data, statistics, evidence as some part of the work that you're doing. And I was struck that on some of it, it's very near-term decision-making. So someone who's ODing on opioids, there's an immediate thing that has to be done to save that individual's life. It's a very short-term, quick thing. Others, you're talking about setting in place systems for child care that may take many years, really, to mature. So how do you think about short-term, medium-term, long-term when you're dealing with data and evidence and planning programs based on data and evidence and the outcomes that you are aiming for in what you're doing? So that's the question. I throw it out for whoever wants to grab and wrestle with that one.
Well, I mean, for easier programs like the Veggie program, that was a kind of a shorter term. I mean, I think that if you have longer term initiatives that are obviously cost more money, then you kind of have to fit the tool with the size of the program and the cost of the program, and as well as the political will. Mm-hmm. So sometimes there's a long lead time of really kind of gathering your wagons and your colleagues to promote an initiative, especially if there's some resistance.
You know, I think that, you know, in terms of early childhood, I think one of the things that we're struggling with in this country, and I didn't say it in my remarks, but those of you who know early childhood in the United States, about 80 to 90% of all of the funds in early childhood are federal or federally driven. So for us in early childhood, it isn't a question of whether or not we do this. We have to do this because federal policy, as we all know, is slow to come. And we do need the data to back up requests for funding. Because, you know, kids are cute and we all love them, but after a certain point in time, people want to know, you know, they want the data to know what the investment is. So it's a long-term versus a short-term when it comes to child care in particular.
Any thoughts?
Well, for our DART unit, there's no short-term fix when it comes to the opiate-related crisis. What we do, like I said, we attempt to get the individual into treatment. They accept our offer, as I said. We follow these individuals up to 2 years after our first engagement. Our officers do not dress in a uniform. We dressed in the kind of attire that I'm wearing today. We do not transport these individuals in unmarked police cars. We transport them in vehicles that have been donated by local car dealerships to form that personal relationship. Our officers are 24/7, 365 days a year. They do not get any time off. They are available to their clients day or night. Relapse is obviously going to happen at one point or another for somebody dealing with addiction. We're there for them as much as we can. We're more of a support system as well as anything else, I guess. It would be the way to answer that. So.
Great. And then one quick question, and then let me do a time check. Who's keeping the time of how much we have left on this panel, given?
2 questions from the audience.
Okay. Can I ask one here? So we're in Washington, if you didn't notice. And a lot of what you're talking about has policy dimensions, appropriations from Congress might help here and there. What do you think for each of your projects and the approaches you're taking, is there a policy dimension to it that, if changed, would be groundbreaking, really a breakthrough for what you're trying to do?
I think for me, just a recognition of the disparity that exists. I mean, when you think about Portland, Oregon, a huge metropolitan area, you tend to think of a wealthier community. But the data bears out that that is just simply not true. So just by proving the fact that we have community residents that are as poor in East County, similar to the people that live in our poorest rural counties. I think that that is a huge statement that says we need more resources in my district and in my county.
What do you find?
I find our biggest need at this time is recovery housing. We're fortunate enough to have enough detox beds available in Lucas County. When this unit started in 2014, there was, I think, 14 detox beds for the entire Lucas County area. Fast forward to today, there's over 135 detox beds available. And that's, we're thankful for the relationships that we built with our local treatment facilities. Now we're trying to find more recovery housing. This is where the relapse is happening. Individuals are going back to their, what they're familiar with. They're encountering the same individuals who are providing the opiates, the drugs, whatever it may be. So now our biggest need right now for us is recovery housing and trying to, establish more recovery housing in Lucas County.
Linda, how would you answer that?
Well, I think that for early childhood, I think that we need a shift in this country and a recognition of the importance of the birth to 3 and birth to 5 years. This country invests a lot in neuroscience, and most of you have seen the research on the child's brain, but we have yet to have our policies follow that research. I have a lot of friends who've done that research, and they're using it in every developed country in around the globe, and we're still yet to use our own research in the way that we need to. So I think a recognition and an honest recognition of the importance of these years and the investment in them. We are going to invest at some point, and I think you're hearing that we're investing on the other end in some of these issues with our population. So it's pretty easy.
Thank you for those. So now, you heard I have a quota of 2, or limit of 2 questions from the floor. Any questions here? Sir, and please identify yourself.
Hi, John. I'll wait for the microphone. John Gathkin with Leaders in Energy. Intuitively, my gut tells me that the way that you address the opioid crisis is getting to the root cause, which for me seems like a sense of empowerment, dignity by jobs, by such like that. Is that your observation, that if we can kind of, cut off the reasons why people feel helpless, that the incidence of opioid abuse would be diminished in creating meaningful work, meaningful jobs?
I do feel that would be a contributing factor. Like I said, our officers are counselors more than officers. They are there for support. Like you said, these people are at bad times in their lives. This is what our officers are there for, 24/7. So I would say absolutely, yes.
Any other questions? I see all the way in the back, over here.
Hello, Stacy Bridges with Veterans Vision. Thank you for what you're doing, especially the officer. I want to know, what are you doing with other people with other addictions? Are they being helped as well? And you mentioned something about beds. We do need beds for these people who are in recovery or who are suffering from adverse side effects to any antipsychotic drug or what have you. What role do you think the federal government can play, since this problem has been legislatively created?
To answer your first question, we do not turn away anybody that's dealing with alcohol-related addiction or cocaine addiction, but we will not follow them specifically in our DART system. We will link them to resources that we can provide to them. We will never turn anybody away. We will offer any kind of assistance that we can do for them. Like I said, Lucas County seems to be a rare county at this point in time with the opiate crisis because we do have the luxury of having, so many detox beds available for us. And that's like I said, that's been built based on relationships with our treatment providers. As far as federal policymakers, I don't know if I have an answer on to what could, I just know based on my experience since February when I took over the unit that the detox beds and the recovery housing are the two biggest issues. And to speak specifically on what federal policymakers could do to implement something along those lines, for us, it's just been the relationships that we built with our treatment providers. Everybody's been on board, from hospitals to private sector to the car dealerships. It's just been a community-wide effort with assistance from Ohio's Attorney General, Mike DeWine. He's provided an immense amount of funding to kickstart the DART unit when it was implemented. And actually now, I believe last count, there's up to 40 other counties in Ohio that are implementing their own unit similar to DART. I know other counties across the country. I spoke to somebody from Iowa who was implementing their own DART unit about a month ago. 3 months ago in Massachusetts, another county is implementing their own DART unit. So to speak specifically on federal policies, I don't have that answer, but I can speak from what I have observed and encountered in Lucas County specifically, and that's just been a community-wide effort from everybody being on board.
I'm going to cheat and do one last quick question from you. Make it quick if you would. Please identify yourself.
Hi, my name is Caroline, and I am a licensed bilingual social worker. I come all the way from Boston, and I say thank you to the BPC to invite me. But I would like to ask to Ms. Smith, how you are able to make our representatives and our senators and the people who can make the decisions in Boston, not in Boston, but here in Washington, to be able to get more money for education. Because if everything begins from the beginning, if the children have better education, then there's not going to be no problems, etc., etc., amen. So how you are able to push the government to give more money so the education is better and the parents have enough money
Thank you.
to be able just to take care of whatever it is.
Yeah.
Thank you.
I think it starts with getting your members of Congress out to see programs and to see what's actually going on in some of this country with early childhood. I think when members, it doesn't matter which party, when they engage in some of these programs and they see actually what's going on with children's learning, it really turns them around. And so I would advise you to get your people in there. Whenever you can get them, just get them out to see some programs and talk to parents, because I think parents are the best place to start when getting to members of Congress. They have a story to tell, and it's very powerful. I think we've got a former congressman sitting here that would say that parents matter when they're talked to.
Great. Well, we've had a great discussion. There are 2 or 3 themes I'd like to highlight from this that resonated for me and maybe for you as well. And I don't pretend to have covered every pearl of wisdom that our panelists brought to us. But one that impressed me is how the approaches they're talking about, by and large, are multifaceted. So in your case, for example, it's not just law enforcement. You have an array of different services and communities involved. It's multifaceted. Same with the use of data for the kids programs, but as well as the spatial mapping for your community. You're engaging a lot of different elements within the system for that. Secondly is the importance of data for real-time decision-making. That seemed to be very important, real-time, but also as we're looking at the longer term, as was discussed. But data also that identifies gaps that need to be closed, low-income communities and people that need to be served, or someone distressed as a result of an opioid addiction. So data for those kinds of purposes for people who are really left out and left behind, which is really what we're talking about in the program today. And then finally, I would say that we already heard evidence that these can scale. And I thought particularly Linda's example, starting in Maricopa County, already spreading to the rest of the state. And you mentioned 2 other states without mentioning the names.
Yes.
But you know, these things can scale. Finally, I just want to thank the people on the panel, because this work and the work of government is hard. And it requires, particularly when you're on the front line, like the 2 of you are, where you're talking to people face to face and trying to meet their needs. That is very, very difficult work. And I know, Linda, you do that too, but you also sit back here in Washington and try and push forward broader progress. But the work of government is hard. I think we just need to recognize that. It's not easy, but we have good people who are out there across the country and communities doing good work, and I think we want to give our panelists a round of applause.